Aloha, U.S. Army, Hawaii, Ohana. I'm Colonel Mary Krueger, Commander of Tripler Army Medical Center, and I'm also a family physician. Joining me today is Dr. Mitch Hamele, a critical care doctor specializing in disaster response and pediatrics. I've asked him to step away from his duties in the intensive care unit here at Tripler to educate us on steps that we can take for ourselves and our families to combat the effects of COVID-19 in our homes and our community.
Thank you, ma'am. Together, we wanted to spend a few minutes with you all to talk about ways to protect yourself, your family, and your community to slow the spread of COVID-19. It's important to note the primary way people get COVID-19 is from person-to-person spread. This includes respiratory droplets from sneezing, coughing, and talking. The highest risk is prolonged contact, more than 10 to 15 minutes within 6 feet of an infected person. The second way is by touching contaminated surfaces and then touching your face, nose, or lips without first washing your hands or using hand sanitizer. It's extremely important to keep your hands clean by washing your hands regularly for 20 seconds with soap and water or use of an alcohol-based hand sanitizer. This is especially important if you have been in a public place.
Well, it's empowering to know, thank you for that one of the main ways to help safeguard our families and our communities is by simply washing our hands and keeping them clean.
It truly is. In addition to hand washing, you can also practice social distancing. Limit your close interactions to a small group of people as much as possible and maintain a distance of at least 6 feet from others. Also, wear a face covering when in public. This should not be a medical grade mask like a surgical mask or an N95 mask. These are in very limited supply and should be kept for medical personnel who are caring for COVID-19 patients and other patients with serious illnesses. A face covering can be made using everyday items from around your house. A towel, a t-shirt, or a scarf, combined with a few rubber bands, can be repurposed into a face covering. Wearing a face covering in public keeps us from spreading virus particles to the rest of the community, to our neighbors, friends, coworkers, and others. If you have been infected with COVID-19 but are not yet showing symptoms, you could spread these particles. Another thing you can do is stay home and limit the number of trips you take outside the house for errands like groceries. When you leave your home for errands, do not bring anyone with you unless necessary.
Well, that's all great information, Dr. Hamele. Now, you're a pediatrics specialist. I wanted to ask you specifically, are there extra precautions that we can take to safeguard our children from this disease?
Yeah, children can certainly get COVID-19, but luckily they generally only have mild symptoms. Reported symptoms in children include cold-like symptoms such as fever, a runny nose, and a cough. Vomiting and diarrhea have also been reported. Despite this, they can still spread COVID-19 to family and other close contacts if they become infected, even if they aren't feeling sick. Children should also practice everyday preventative behaviors just like adults. Really, the key to slowing the spread of COVID-19 is to limit contact as much as possible. While school is out, children should not have in-person play dates with children from other households. If children are playing outside of their own homes, it is essential that they remain 6 feet from anyone who is not in their own household, wash their hands frequently, and don't share toys. To help children maintain social connections while social distancing, help your children have supervised phone calls or video chats with their friends and family.
Thank you for that. That's good for the technical part, but you know, I have 5 kids at home. Do you have any recommendations for me on how to talk to my children about COVID-19 and what it means for them? They're pretty scared.
Absolutely, ma'am. I have 3 young children myself. Talking to your children about COVID is important. When I talk to my kids about COVID, we talk about a new germ that doesn't usually make children sick, but when they touch other people or things, they can spread those germs. By staying farther away from people and washing hands frequently, as well as covering their mouths with their elbows when they cough or sneeze, they are being heroes, protecting people like their grandma and grandpa.
Thanks, Dr. Hamele. Can you provide me more information on how to protect family and friends if I think that I might have COVID-19?
Yeah, if you think that you might have COVID-19, stay at home and isolate as much as possible. Most people with COVID-19 are able to recover at home without medical care. Try and set up a separate restroom and sleep area and spend your time in a room separated from the rest of your family. If you must come out to interact, wash or disinfect your hands well. Put on a mask, and when you are done, wipe down any surfaces you have touched with disinfectant wipes.
I also want to take this opportunity to remind our beneficiaries of the options you have if you believe you have COVID-19 or have questions about it. You can call the COVID-19 hotline at 1-888-MTF-APPT, option 8. They are open from 7 a.m. to 4 p.m. Monday through Saturday. Tripler and Desmond Doss Clinic are offering drive-through screening and testing at Fort Shafter Flats for Tripler and at Schofield Barracks for Desmond Doss. The site at Fort Shafter Flats is open Monday through Saturday, 8 a.m. to 4 p.m. For Desmond Doss, their drive-through screening and testing is open Monday through Friday, 11 a.m. to 5 p.m. On Saturday and Sunday, testing and screening will be conducted at the Acute Care Clinic from 7 a.m. till 6:30 p.m. at night. To expedite the process and reduce wait time, patients can call the hotline first and be screened to determine if you need to have a test. And if you do, they will place that test for you. Now, you should seek emergency care if you have trouble breathing or have persistent pain or chest pressure. Call your doctor or emergency department before going in. You can tell them your symptoms and they'll give you advice on any protective measures. In case of a true or critical emergency, call 911.
In closing, the best thing we can do to keep ourselves and families safe and healthy is wash our hands often, isolate as much as possible, and wear a non-medical grade face covering in public.
Thanks, Dr. Hamele. Those are all great tips. This is definitely a community effort throughout Hawaii. I appreciate all that everyone is doing to help slow the spread of COVID-19 throughout our community. Flatten the curve, raise the bar, Army strong.